Good morning. We are so happy to be with you again on ZoeTV. And the good/bad news is that you're stuck with Steve and I for the entire time.
Yeah, I think it's one of these episodes that we do once in a while where we feel like we have so much to talk about. We pushed all the guests to next week, and we just have a lot of talking points that I think is important.
Well, and I think before we start, I want to warn you right now, I think a really good thing to do would be to get a pen and some paper, because you might want to take some numbers down or some notes as we go along. If not, we're going to have this stuff up on Channel 2, and it will be in the Informer. But I think you and I are the ones that get a lot of the calls.
We do.
Don't you?
Do. I agree.
And I think what Steve and I had discussed before doing this is, let's just get on and talk about the things that are coming up, the good things, and the not so great things, and then kind of answer some questions that people have asked us.
Yeah, I agree. I thought, coming off of last week when we had Scott on and was be able to hear from leadership on perspective and timelines, and we're now another week down the road.
Right.
It's there's a lot of stuff still in flux, and we don't know, but I think we do know a lot more than we did a week ago.
I would agree with that.
I think it's important to kind of, like you said, get your pens and paper out, and as always, because you guys do it anyway, is reach out to us with questions. So talking points that we do have on today's show, if you need further explanation, that's what we're here for.
Right, and just so you know, I think you know this, but Steve and I spend a majority of our time thinking about what we can do with the residents and what needs to change to make that possible.
Right.
I mean, we really do. We don't want to just let things go and not be active with you and not be engaged. So some of this stuff's pretty exciting. But I'm going to start out with our dreaded, I don't know what we want to call COVID. Okay, so we are working diligently. I can tell you it's on everybody's mind, especially in senior staff, to get the vaccine here on campus for the rest of the residents, all the IL, the rest of the AL, and we do not have a date for that yet. And I know another thing, I say this every time, our worst enemy is sometimes the news. Because the hard part about COVID is it's not a national program. It's state by state. So when you hear that North Carolina has vaccinated everybody in long-term care, independent, everything, it's easy to go, why not us? And we're with you, but it's really state-driven. So our state just yesterday lowered the age to 65, but you still have to go out to a facility and get that. So we are working on it, but if you get the opportunity to go off campus and get the vaccine, do it. It's really a good thing. So they're working on assisted living first and then independent living. Like I said, it's not on us, believe me. And there are so many senior living places in Arizona that everybody is trying to get the same vaccines, right? But I'm going to try again to tell you about the State Farm Arena, if you can get there. And unfortunately, we can't transport people. COVID has limited that ability. But your family or your friends, if they have a car and they're able to take you, that is your best option. So, again, you need to have a computer to make an appointment for that. It doesn't work on your phone. And if you do have a computer, you can go to the azhealth.gov/testing. And I've heard from several of the residents, some who've gotten appointments, but some who've had to wait a week or two. They could schedule it, but it's a week or two down the road. And some, they're just giving up because, like I said Monday, you got to take with you patience and time, because sometimes you're going to wait online for a few hours. But there's also an Arizona COVID hotline, and that number is 844-5 548-8201. And that's if you don't have a computer, you can call and they will call you back. You can leave a message, but it's way better than just holding online. So if you want to call that number, again, it's 844-548-8201. Otherwise, if you have a primary care physician, call them and see if they're giving the vaccines, because many are. So I would start there. I would start by calling my own doctor and saying, what do you think is the best for me? Because we're all in the same boat. Everybody wants the vaccine. Well, most of us. I wish it was every single person, but most of us want the vaccine and want to move on. So if you have any more questions, you can call the HR department, and Cynthia can help you at 623-847-3019. So, okay, enough about COVID for now.
Yeah, I think,
although it weaves through the rest of our stuff, but
a lot of the talking points we have today are different. They're very programmatic. They're about getting back into yellow and getting out of red, and where this campus has unfortunately had to go in the last couple of weeks. But I will say, to echo your point on the vaccines, that you and I do field a lot of calls. And I think what I tell people is, the vaccine is the good, the bad, and the ugly, in a sense that we had to start with skilled nursing, and we're being dictated to by the state.
Yes,
it wasn't
our
our
decision
decision to say, hey, you know what, the best place is Providence Place. No, we had to start there. We had to start with staff and residents, then move to AL, and then it's IL is the final hurdle. And it's one of those things that as I walk through campus and talk, the frustration's high, because, and like you said, it's good people want the vaccine. It would be, it'd be a different conversation if people didn't want to get it,
right,
and we were trying to hopefully steer them in that direction. But the fact that so many people want it is a positive.
Right.
But it's patience. You guys are doing the right thing. We're at the final home stretch here of, mask up, stay home, until we finally get to that point of doing the IL residents.
Well, and can I say one last thing about that is, you can't get the vaccine if you have COVID. Yeah. And I think you have to test negative if you've had COVID to get it. So wearing the mask, staying isolated, staying safe is really your best bet between now and getting the vaccine, because the worst thing would be to not get COVID and then have them come on campus with the vaccine, because you can't get it when you have COVID. So stay safe.
And we could, I think, unfortunately spend an hour on COVID, but my last talking point is, and it's been the sentiment from the beginning, if you have symptoms or you're feeling any, please tell someone. Don't be in the boat of, I don't want to let anybody know, I'm going to hunker down, and because when we get that vaccine, like you just said, I want to get it. And I'm not going to say anything, and I'm going to be really careful, and you have to tell people. You have to let us know so that we can do our stuff the right way.
Right.
And I think there have been a few situations of people holding on to, I'm positive, or tell a few people, and then the Glencroft rumor mill goes wild. And, our leadership and our staff and residents need to know who's out there, who's suffering, who needs help, so we can best accommodate and keep this needle moving forward and getting out of this.
Right.
So enough on COVID. Can we talk about something positive?
Yes, let's talk about something else.
Okay, I'm going to go into a couple programmatic pieces that's going to move the needle and get us back into working with you, which is absolutely our favorite thing to do on campus and what all staff loves doing. Obviously, our dining people love to feed you, our activities love to entertain you, and our ZoeLife team downstairs want to work with you and make you better. And that's kind of the two talking points I have back to back are some fun initiatives that we're going to start. The weather's perfect. The walking path has been open this whole time, so we wanted to think outside the box of how to utilize the path, being that the Performance Center is still closed, to accommodate you that are getting my phone ringing off the hook of when can we work out, when can we do stuff. And so the first one is called our Zoe2Go Team Walking Challenge. And so, we've had our mile marker challenge over the last couple months, and we've had a lot of success, and we've had multiple people walk all the way to Las Vegas, accrue enough miles to literally walk to Las Vegas. And so what we've done is anybody that's accrued the miles to get to Las Vegas, we made a team captain. And we've established at this point 5 different teams comprised of residents that are accruing miles as we speak, an employee on each team is going to be kind of a co-captain, and then those that got to Vegas being captain and kind of steering their ship for their team. And so starting on February 1st, we're going to launch this ZoeTV campaign where, they're going to have your typical walking mile journal, and each team is going to be accruing miles for their team in competition with one another. And I think it's going to be a fun way that, again, we're still doing the same thing. We're tracking miles. We're trying to get you on the path, but just a different abbreviation of it, where we're going to have some cool prizes. Ross is making some great T-shirts. We're going to make it a competition of sorts where the 5 teams are going to just battle for miles, and we're going to have a great leaderboard that's going around campus. And it's one of those things, if you haven't been accruing miles and are on our current mile marker challenge leaderboard and you want to participate, call Gerald in the Performance Center or Michelle Jones at 623-930-5697, and that's going to allow you to say, hey, I want to keep track of my miles and be on this team. And it's nothing that you would have to do socially. It's on your own. You're accruing miles. If you want to do it at 6 in the morning or 6 at night, you're keeping track of your own miles, and you're turning them into your captain, and you're just having fun and being part of what we hope is that social pillar still engaging in COVID. And it's one of those things, when we go into Code Red and we go into isolation, it's the opposite of Zoe Life. Mm-hmm. It's the opposite of, and I hate the word social distancing. It should be physical distancing, right? I hate that we call it social distancing, because we still need to connect. We still need to talk. We still need to be interacting and growing that social pillar. And social distancing is just nails on a chalkboard for me. It's truly physical distancing. We don't want to be in front of 6 feet and all that comes with that. But the idea of this mile marker challenge kind of, again, moves the needle a little bit on the social pillar. It gets you physically moving. But I think, that the way we've established these teams is kind of the leader in the clubhouse, Tom Grody, who's out there, and everybody knows he's just hustling around campus. He has miles after miles. His kind of team is just him and maybe one other person competing against other teams of 5, 6, 7, or 8. So it'll be interesting how this plays out. Right. With the miles breaking down. So
and we're going to be on a team.
I'm on a team. I'm not going to tell you who team, but I'm on a team.
You're
on a team.
I'm not telling you who.
We've got some good employees taking part. So ZoeTV Challenge, please reach out to us if you have questions on that. The other programmatic piece that we want to talk through on the walking path is that of our new walking path fitness class. We thought, with the weather perfect, would it be cool to create kind of a station circuit fitness oriented path experience? So come experience the walking path like you never have done it before, with myself, Gerald, Michelle, possibly other employees out there having individual stations where you will walk through. You walk up on a station, you do an exercise, you stretch with us, we interact, we have fun, and then you're off to the next station. So we've kind of outlined the north and south trail with various stations along the way. And so this circuit format is coming. We're going to start next week. There's slides up on channel 2, but every Monday, Wednesday, Friday from 9 to 11, we're going to be out on that path, and we're going to be out there to cheer you on. We're going to be out there to work you out a little bit, have fun with you. It's not going to be really extensive, but we're going to bring a lot of the equipment from the Performance Center out on the path so that you can experience some of what you were doing down there with the resistance bands and balls and weights and tables and stretching, and just be outside so we're safe. But enough of being in this Code Red. We've got to move the needle and move the physical pillar back to where we were.
In a safe way. And so is that a group activity, or is that an individual?
It's an individual activity. Because I have a 2-hour window that we're running this on, I can see us probably having multiple residents out there at the same time. But it's something that we've done in the past at our other facilities in terms of places I've been where we have a great walking path and create stations. And so we'll be very good about spreading everybody out.
So
and making sure if my zone and my station of dumbbells and bands and balls are full, I'm going to shift you over to Gerald, and then you're going to run back to me. And I think it's just going to be a fun, interactive way to get you working out. And again, no appointment necessary. You literally just come out to the start of the trailhead right by Henry's. And it's some days we're going to use the north, and some days we're going to use the south. And we've got so many good grass areas. I mean, the beauty of these 40 acres of these big trees and grass, and Gerald and I spent a lot of time this last week kind of mapping this thing out. And we were just blown away at how much space that we really have to work with in terms of safety first, flat, non-slippy, just a cool spot. So we're going to really have some fun in the next week or two with that.
Well, and it never rains here, so you should be in really good shape.
We haven't had rain in...
Well, I don't even remember what it feels like. Okay, so
that being said, the Performance Center has been the crux of a lot of my calls. When are we opening? What scenario are we going to get to be able to have people back in there like we were? And during COVID and right up till we had to close again, we had the same 10 people. We locked it down at 10. We had the health screenings upon entry. We cleaned. Everybody that with us know how deep clean. I think I took out every top layer of every piece of equipment in that thing with the amount of cleaning Gerald, Michelle, and I were doing. But we've reached the point of, in the next couple weeks, I'm not going to give a date because it's a little bit in flux in terms of cases in IL, but as the vaccine comes in and our strategy of let's get the walking path out first, let's be smart about this, the next shoe to drop will be the Performance Center, and that's going to be done by appointment. So the timeline, again, is a little bit to be determined, but the idea is we've already done the heavy lifting of going back 2, 3, 4 months and trying to figure out the usual suspects that use the Performance Center, what schedules you were on. And we've come up with about 65 names NIL of the usual suspects down there. We've created, my office looks like an NFL draft room where everybody's time allotments are. And so we're going to be starting the process of calling you and asking you if you want to participate, here's your time. We're not going to go back and forth of, I don't want that time, I want this time. We did our best. We're going to assign you times if you want it. We're going to green light you when we open into that time. We're going to make you schedules. And if you haven't got a call by next week, please feel free to call, again, Gerald, myself, Michelle, and say, hey, I would love to be a part of that appointment schedule, and just give us your name, give us a time you would hope to be built around, and we'll accommodate. And because, again, the goal is to do this safely. The Performance Center has always been a little bit by appointment. We kind of know what you like, but we're really going to go strict this time as we reopen in terms of, hey, here's the time we're going for. You are Tuesday, Thursday, 8 a.m.
Yeah.
And we're going to do all the precautionaries coming in. We're talking about the idea of coming in for that particular week. You have to have a negative COVID test, whether you do it with Charlene and Tommy out front, or you do it in HR, or you do it with us. We're working that back of the house strategy. But the idea of either having a vaccine when IL finally gets it, or having that negative COVID test upon entry really opens the door from a safety wise for us to know, okay, we feel good about this. The appointments are 4 max per hour, so we're able to spread everybody way out. So we really feel good about our plan. And I think at the end of the day, that's what we really want to get across is we've used this downtime to really create strategies because we don't know where this is going to go. And like before, we hoped we wouldn't be back here, but we are back here.
Right.
And so having default plan A, default plan B is super important in this going forward. So that's a Performance Center.
Those are good things coming up. I'm excited. I do too.
And you're going to be a team captain, co-chair.
Out there walking. I already am. But okay, so the other good news is we are opening the university again.
Yes, we are.
So the spring 2021 class will start on February 8th. We know for sure February we will be doing all of them virtually. So you don't need to sign up, but you do need to let us know if you watch, because you can get credits. They will all be shown on Channel 4 live. And when we first started, a lot of these presenters wanted to come on campus. Right. But in February, unfortunately, we have some good ones, but they can't. So it'll all be virtual. If and when that changes, we're going to let you know. But for right now, you don't need to sign up. You just need to get the schedule, which will be out on the 18th.
I believe so.
The catalog will be out on the 18th, and you can pick that up at the concierge desk or at the receptionist. So we want you to get the schedule so you'll know what to watch. And I think we're going to be putting even the schedule up. I know it's in the Informer, so there are a lot of ways to get it. But if you want the catalog so you can see all the classes, it will be printed. And the food pantry, another positive thing on our campus. We're going to continue that. We did it Wednesday, and it was very successful. People were very cautious and conscientious of staying 6 feet away from the person in front or behind them. So it came off well. People love it. I know it is fun. I work in it every time just 'cause it's fun to see people again. But that will continue. And, you know, I'm happy to report that we've raised $102,000+, and we have a lot more grants out there as well. So the donations really do help us keep that going on our campus.
I think the food pantry is something we've talked about from the beginning of this, is kind of a best practice going forward, and whether that evolves into a organic farmers market and we take that on a whole nother spin once we get past COVID, and we're like, man, our people really responded to that idea of community and coming together and getting a bag and filling it up. And right now it's staples and it's toilet paper and it's things we need.
But lots of fruits and vegetables.
That's right. And that's where I was
you
going.
You haven't been in a couple times, but let me tell you, a third of it is all fresh fruit and vegetables.
And that is really kudos to you and the team executing, because when we started it, it was a lot of baked goods, a lot of flour, a lot of staples. And now it's progressed to what you just said. And that's, I think, what's been cool about this, and where that will even evolve to more is, you know, I envision a Saturday food pantry, but it's a farmer's market with music and it's engaging, and I think that's something that will come out of this is best practice, and what this campus turns to is a new norm. So I want to go back real quick on the university. I think everybody is excited about getting back into some virtual learning. I think that having the catalog come out will give a sense of anticipation, because, you know, on the back end, there is a lot of work that is involved on getting people, not the usual suspects, trying to think outside the box of instructors that would come on or Zoom in and give you valuable information. And again, we say it every semester, but they do this out the goodness of their heart. We're not paying for these. They just bought in on our mission for continuing education, and I just think it's so important, no matter what, with COVID, and it's such kudos to AV and our IT team to be able to facilitate using our technology and some of the grants that we have received to facilitate these on Channel 4. And we want to keep the accruation, is that a word?
Well, it is now.
I like it. We want to keep that continuing. And so, you know, if you watch a show and you watch a thing and you're interactive, and you don't even have to make that call with a question, but you want to fill out the survey and the Q&A that we have, those are going to be made available prior to our first lecture in stacks. And I always recommend grabbing a stack from the admin or concierge, keep it at your house, and when the mood strikes you, you're like, I need a pillar, lecture credit here. You fill it out, you turn it in, you get your credit. And because what's going to be cool is if everything shapes out the way it should, this semester is going to be our first graduating class. And we have a handful of residents that have been engaged from the start.
Yes.
I can tell you right now, that party is going to be not virtual, it's going to be very real.
Very fun.
And it is going to be a blast.
And part of the survey is you've written what you want next, and we've listened. I'm trying desperately to get someone to come on camp, I didn't this semester, but I'm working on it with somebody who will come on and teach a class on the planets and the stars. That was a request. So we really do read those and try to accommodate. So
yeah, that's a great point. All right, finally, on the last couple talking points, the pool. The pool is kind of like the last one to drop. and I know I've received a ton of calls on the pool. So many of you out there use the pool. We're in the water, our team with you guys on a regular basis with Parkinson's and stroke, and we miss it as much as you do. And I know so many residents, that's their resource. That's how they get in the water to work on their knees and to work on their back. And it's one of those things that unfortunately, you know, everybody in the water isn't wearing a mask. The jacuzzi becomes a popular spot to kind of like just hunker down. So it was a shoe that unfortunately dropped. It's going to be the last one to come back. So once we kind of have a stepping order, but I wanted to talk through the pool. If people have questions or concerns on the pool, call me directly because I can kind of walk you through our strategy and scenario that we reopen. But I don't want people to think we forgot about the pool because the pool is a primary emphasis for us. And then finally, the talking point I get a lot of the cookbook. I mean, how excited are we about the cookbook?
Very.
I mean, the cookbook, it's pretty spectacular.
Do you want to tell them what I uncovered the other day?
It's like a little treasure. Go, tell them.
Okay, I was cleaning out my office. I guess this doesn't say too much about keeping my office neat, but I found a cookbook from Glencroft Residence from 1985.
Unbelievable.
And it was typed.
It was
awesome.
It is unbelievable. So we are it's actually an amazing size. It's like, I showed it to our kind of creative team and they were like, oh my gosh, this is the exact size we want to do. This is the binding, this is everything. And so I think there are going to be snippets of that in the new, but look for the cookbook. It's going to be out. My guess is in February. I'm fielding a lot of calls on it, but it's been amazing to watch our dining team flip your recipes into healthy, and then watch a lot of the testimonials and storylines come through. So the cookbook is going to be an amazing project.
Yes, it is.
And with that, this just flew by. I got no more. I mean, I got a lot more, but we're kind of out of time.
Yeah.
I mean, who needed guests? Maybe this is our new platform.
Oh, who wouldn't want to listen to us for 30 minutes?
It's unbelievable.
Yeah, we like it.
We do. We enjoy this time. But call us, either one of us. Our doors are always open, right? I know mine is. I know yours is.
Yes.
Because I see your phone going bananas all day, every day. But please, you have our numbers. Any questions on anything we talked about, any questions on concerns, vaccines, please call. That's all we can do is tell you what we know.
Right. And we will.
Transparency.